During the next couple of months, millions of Americans will have the opportunity to pick a health plan for 2023 or make changes to the current coverage in what is known as open enrollment. Joining us now to talk about the upcoming enrollment season and to share tips on what to look for in health plan is Dr. Rhonda Randall, Chief Medical Officer at UnitedHealthcare. Good morning, doctor. How are you?
I'm well, Brad. Thank you. Thank you for having me.
Okay. For some people that don't know what open enrollment is all about, can you explain it to them?
Well, this is the season of open enrollment for your health care benefits. So if you are one of the 180 million Americans who get your health care coverage through an employer-sponsored plan, generally your employer is going to give you about a 2 to 3 week window sometime between September and December to choose your coverage for next year. If you're one of the 64 million Americans who get your coverage through Medicare, your open enrollment period begins annually on October 15th and it ends every year on December the 7th.
Got it. Okay. Let's talk about tips on, of course, picking the right plan and saving money, because that's what this is all about.
Absolutely. One of the most common questions that I get. The first thing is take the time now to get educated on what your choices are for next year. You don't want to wait to the last minute. If you're happy with your current coverage, it will roll over until next year, but you want to understand what other options are available to you and if something in your situation is going to change from the decision you made a year ago. Perhaps you're expecting the birth of a child in 2023. That's a good time to reassess your coverage. I also recommend looking at a checklist of some important things. First one, prescription drug coverage, the most commonly used service in healthcare. So make sure that you're understanding your prescriptions and are they on the formulary for your health plan. Mental health benefits might be one that you didn't think about in the past, but we all know how important behavioral health came to the forefront over these last few years. Even if you or a family member doesn't need it now, you want to understand what that coverage is in case you do need it in the future. Specialty benefits are another one, things like dental, vision, and hearing. Check those out, see if they're included or integrated in your plan or available as supplemental plans. Look into wellness programs. Many plans include things like preventative care and fitness benefits, even gym memberships, for example. So understand what that coverage is. And then last but not least, virtual care services. Telehealth has become very popular over the last few years, and you may want a plan that includes telemedicine services.
I like all this. This is good. Now, what about the whole person health that we've been hearing about, and why is this important?
So we know that there is an important connection between our physical health and our mental health, but it doesn't stop there. It includes things like social determinants of health. Where we live and work matters to our health. The choices and behaviors we make as individuals. So all those things that we know that are good for us, of eating healthy and getting some physical activity and not smoking, for example. I also recommend to have a primary care physician. So important to whole person health. Primary care physicians can be that advocate for you that helps navigate the healthcare system with your personal healthcare needs.
Got it. Doctor, this is very important information that we have here. Where can people find out more?
We have all of this information on our website. It's uhcopenenrollment.com.
Perfect. Doctor, thank you very much for joining us.
Thank you. Be well.